HESI EXIT Postpartum Care. Welcome to HESI EXIT Maternity Nursing Postpartum Care. This comprehensive guide will help you understand maternal recovery, potential complications, and essential nursing interventions during the postpartum period. Introduction to postpartum care. The postpartum period is a critical time of physical and emotional adjustment. Definition. The postpartum period, also called puerperium, lasts from birth to 6 weeks. During this time, the body returns to its pre-pregnancy state. Multiple physiological changes occur simultaneously. Key aspects of care: physical recovery from pregnancy and birth, emotional adjustments to motherhood, newborn bonding and attachment, breastfeeding establishment and support, family adaptation to the new baby. Phases of postpartum period. The postpartum period is divided into 3 distinct phases. Immediate postpartum, first 24 hours. Recovery from labor and delivery. Monitoring for immediate complications. Initiation of breastfeeding. Bonding and attachment begin. Early postpartum, up to 1 week. Uterine involution progresses. Breastfeeding becomes established. Physical discomfort peaks then improves. Maternal role adjustment begins. Late postpartum, weeks 2 to 6. Emotional adaptation continues. Return to normal activities gradually. Final physical recovery occurs. Family routines establish. Postpartum physiological changes. Understanding normal postpartum changes helps identify complications. Reproductive system. Uterine involution returning to pre-pregnancy size. Vaginal changes and healing. Lochia progressing through stages. Cardiovascular system. Fluid shifts from extracellular to intravascular spaces. Risk of thromboembolism increases. Blood pressure stabilization. Endocrine system. Hormonal fluctuations affect mood and lactation. Return of menstruation varies, especially with breastfeeding. Prolactin levels increase with nursing. Urinary system. Postpartum diuresis eliminates excess fluid. Risk of urinary tract infection. Bladder sensation may be decreased initially. Gastrointestinal system. Constipation common due to hormones and pain medications. Hemorrhoids may develop or worsen. Appetite and digestion normalize. Bubble HE assessment. The Bubble HE framework provides systematic postpartum assessment. B. Breasts. Check for engorgement and firmness. Assess nipple condition and integrity. Evaluate lactation and milk production. U. Uterus. Assess fundal height and position. Check firmness and involution progress. Perform fundal massage if needed. B. Bladder. Monitor urination patterns and output. Check for signs of urinary tract infection. Assess for retention and distension. B. Bowels. Evaluate bowel function and constipation. Check for hemorrhoids and discomfort. Encourage fiber and fluids. L. Lochia. Assess vaginal bleeding color, amount, and odor. Monitor for excessive bleeding. Track progression through stages. E. Episiotomy/incision. Examine perineal healing. Check for signs of infection. Assess C-section incision if applicable. H. Holman's sign. Screen for deep vein thrombosis. Check for calf pain with dorsiflexion. Assess for leg swelling and warmth. E. Emotional status. Evaluate mood and bonding. Screen for postpartum depression. Assess coping and support systems. Uterine involution and fundal assessment. Uterine involution is the process of the uterus shrinking back to pre-pregnancy size. Expected findings. Immediately after birth, the fundus is at the umbilicus. Day 1 postpartum, the fundus is 1 centimeter below the umbilicus. The fundus decreases approximately 1 centimeter per day. By 10 to 14 days, the uterus is non-palpable below the pubic bone. Complete involution takes about 6 weeks. Nursing interventions. Perform gentle fundal massage to maintain firmness. Encourage frequent breastfeeding as it stimulates oxytocin release. Monitor for signs of subinvolution like prolonged bleeding. Empty bladder regularly as full bladder displaces uterus. Educate mother on normal involution process. Lochia assessment. Lochia is the vaginal discharge following childbirth that progresses through distinct stages. Stages of lochia. Lochia rubra, days 1 to 3, is bright red with heavy flow resembling menstrual period. Lochia serosa, days 4 to 10, is pink or brown with moderate flow. Lochia alba, days 11 to 6 weeks, is white or yellow with minimal flow. Normal characteristics. Decreasing amount over time. Musty, non-offensive odor. May contain small clots. Warning signs. Heavy bleeding soaking more than 1 pad per hour. Large clots bigger than a golf ball. Foul-smelling discharge indicating infection. Bright red bleeding after it has turned pink. Excessive or prolonged bleeding. Perineal and incision care. Proper perineal care promotes healing and prevents infection. Episiotomy and lacerations. Use sitz baths with warm water for 15 to 20 minutes several times daily. Apply ice packs in first 24 hours to reduce swelling. Maintain perineal hygiene with front to back wiping. Use topical sprays or anesthetic pads for pain relief. Take prescribed analgesics as needed. C-section incision care. Keep incision clean and dry. Monitor for redness, swelling, or drainage. Check for signs of infection like fever or increased pain. Teach proper dressing changes if applicable. Support abdomen when moving or coughing. Avoid heavy lifting for 6 weeks. Breastfeeding and lactation support. Breastfeeding establishment is a key focus of postpartum care. Breast changes. Engorgement typically peaks around 3 to 5 days postpartum. Colostrum production in first few days is rich in antibodies. Transition to mature milk occurs around day 3 to 5. Breasts may feel full, warm, and tender. Nursing interventions. Encourage early breastfeeding for proper latch and bonding. Provide education on positioning techniques. Support nipple care to prevent cracking and soreness. Treat engorgement with warm compresses before feeding. Use cold compresses between feedings. Encourage pumping if needed for relief. Educate on signs of mastitis. Benefits of breastfeeding. Provides optimal nutrition for infant. Transfers maternal antibodies. Promotes uterine involution. Enhances maternal-infant bonding. Postpartum pain management. Effective pain management promotes recovery and bonding. Vaginal birth pain management. NSAIDs like ibuprofen for inflammation. Acetaminophen for general pain relief. Perineal care with ice, sitz baths, and witch hazel pads. Topical anesthetic sprays. Cesarean birth pain management. Opioids as needed for acute pain. Transition to oral medications. Abdominal support with pillows. Splinting incision when coughing or moving. Non-pharmacologic pain relief. Warm packs for muscle aches. Proper positioning for comfort. Breathing and relaxation techniques. Rest and sleep when possible. Gentle movement and stretching. Emotional and psychological changes. Postpartum emotional changes range from normal adjustment to serious disorders. Baby blues, common, resolves in about 2 weeks. Mood swings and emotional lability. Tearfulness without clear reason. Excessive anxiety about baby. Requires screening using Edinburgh scale. Needs professional treatment with therapy or medication. Postpartum psychosis, rare but severe. Hallucinations and delusions. Confusion and disorientation. Thoughts of harming self or baby. Requires emergency psychiatric referral. Considered a medical emergency. Maternal nutrition and activity. Proper nutrition and gradual activity return support recovery. Nutritional needs. Add extra 500 calories per day if breastfeeding. Maintain adequate hydration with 8 to 10 glasses of water daily. Ensure sufficient iron intake to replenish stores. Include protein for tissue healing. Consume fiber to prevent constipation. Activity guidelines. Encourage early ambulation to prevent complications. Begin pelvic floor exercises, Kegels, to strengthen muscles. Avoid heavy lifting for 6 weeks, especially after cesarean. Gradually increase activity level. Listen to body and rest when needed. Walking is excellent gentle exercise. Postpartum hemorrhage. Postpartum hemorrhage is a serious complication requiring immediate intervention. Causes. Uterine atony is the #1 cause. Retained placenta or placental fragments. Lacerations of cervix, vagina, or perineum. Hematomas in the genital tract. Signs and symptoms. Heavy bleeding soaking pads rapidly. Hypotension and dizziness. Tachycardia and rapid pulse. Signs of shock including pale, cool skin. Interventions. Perform vigorous fundal massage. Administer 4 fluids rapidly. Give oxytocin or other uterotonic medications. Empty bladder if distended. Prepare for blood transfusion if severe. Notify provider immediately. Monitor vital signs continuously. Postpartum infections. Infections can occur in various sites during the postpartum period. Types of infections. Endometritis is uterine infection, most common after cesarean. Mastitis is breast infection, usually in breastfeeding mothers. C-section wound infection at incision site. Urinary tract infection from catheterization. Signs and symptoms. Fever above 100.4 degrees Fahrenheit after first 24 hours. Foul-smelling lochia suggesting endometritis. Localized pain, redness, and warmth. Increased white blood cell count. General malaise and flu-like symptoms. Treatment. Antibiotics specific to the infection type. Hygiene education and wound care. Pain management. Continued breastfeeding with mastitis. Warm compresses and rest. Thrombosis and DVT risk. Blood clots are a serious postpartum complication. Risk factors. Cesarean birth increases risk. Prolonged bed rest during pregnancy or after birth. Obesity and advanced maternal age. History of clotting disorders. Dehydration. Signs and symptoms. Unilateral leg pain and tenderness. Swelling in one leg. Warmth and redness in affected area. Positive Holman's sign, pain with dorsiflexion. Prevention. Early ambulation after delivery. Compression stockings for high-risk patients. Adequate hydration. Leg exercises while in bed. Heparin prophylaxis if indicated. Family planning and contraception. Discussing contraception is important before discharge. Timing. Ovulation can return as early as 4 weeks postpartum. Breastfeeding delays ovulation but is not reliable contraception. Pregnancy is possible before first menstrual period. Contraceptive options. Progesterone-only pills are safe for breastfeeding. IUD can be placed at 6-week visit. Barrier methods like condoms can be used immediately. Avoid estrogen-containing pills for 6 weeks postpartum. LAM, lactational amenorrhea method, has specific criteria. Education points. Discuss options before discharge. Consider future pregnancy plans. Address concerns and preferences. Schedule follow-up for placement if needed. Discharge teaching and follow-up. Comprehensive discharge education prevents complications. Warning signs to report. Heavy bleeding soaking more than 1 pad per hour. Fever above 100.4 degrees Fahrenheit. Severe abdominal or perineal pain. Foul-smelling lochia. Signs of postpartum depression. Breast redness or hardness with fever. Leg pain, swelling, or warmth. Self-care instructions. Perineal and incision care. Pain management strategies. Activity restrictions and progression. When to resume sexual activity. Nutrition and hydration. Follow-up appointments. Vaginal birth, 6-week postpartum checkup. C-section, 2-week incision check plus 6-week visit. Earlier appointment if complications arise. Newborn pediatric appointments. Summary. Let's review the essential concepts from Module 3. Key takeaways. Postpartum recovery involves physical, emotional, and psychological changes. The BUBBLE-HE framework helps ensure comprehensive maternal assessment. Complication awareness allows for early intervention and prevention. Education on self-care and newborn care is crucial for successful transition. Emotional support and screening for postpartum depression are essential. Follow-up care ensures complete recovery. Thank you for watching Postpartum Care. You now understand the complexities of postpartum recovery and how to support new mothers effectively. Your comprehensive knowledge will help you provide excellent maternal care.